Hi, good morning, Teresa. It's Carla. Are we ready to begin?
Good morning, Carla.
Good morning. I'm so sorry I couldn't be there in person.
Thank you for still joining us via Zoom. I know. I like it when you're here.
I know. I miss seeing you all. Next time for sure. We have lots of things going on today.
Yes.
Do we have a quorum? Are we ready?
We'd have, but let's do the roll call and make sure we've got everybody covered. So Carla, I think you're here.
I am here.
Tina Mariano.
Yes, sir. Good morning, President and accountant.
Thank you. Chief Michael Akides.
Good morning, mic's on.
There you are. Jim Landborg, have you joined us? Not yet. Harry Robbins. Let's see, Harry. Jody, there you are on my screen.
I'm here.
Yeah. Luz Garcia, I see you also.
Yes.
Paul Wood. No. Dr. Nicholas Greenson. Not yet. Greta Steinbrunner. Not yet. Tina Nieto.
Yeah, Tina's here.
Yeah, there you are. Beautiful. And John Anthony.
John's here.
Perfect. Thank you. That's 1, 2, 3, 4, 5, 6, 7. Yes, we have a quorum.
Okay, perfect. I know Dr. Nick Greenson is out of town, so he will not be here. So we can mark him absent. Okay, so we will continue. Do we want to do some introductions? We can go start in the room and then just whoever was not a part of the roll call, maybe to introduce yourself after on the Zoom. So let's start in the room.
Kimberly Hernandez, EMS analyst.
Deborah Hopgood, EMS analyst.
Jeff DeAndrea, EMS analyst.
Teresa Rios, EMS director.
John Burley, EMS medical director.
Steve Brooks, EMS analyst.
Okay, great. And anyone that was not a part of the roll call on the Zoom, if you can go ahead and introduce yourself.
Will Hiller, AMR CES.
Michelle Polinsky, Chomp.
Roxanne Superset, EMS. Anna, what is my position? Oh my God, Effie. I hear the word analyst and I think the same thing.
You're an epidemiologist, Roxanne.
Thank you. I am the Effie.
And Susan Bledge from County Counsel's office.
Hi, everybody. Eric Welling, Monterey County Regional Fire.
Mike Hesslinger with AMR. Hello, everybody.
Hello, John Anthony.
Yes.
Good morning, Liam Magofsky, Emergency Communications.
Robbins is present. Harry Robbins.
Harry Robbins, I understand you're with us. We're still connecting to audio.
Oh, yes, he's still connecting.
This is Reb Close from Chomp, and then as well the Monterey County Prescribed Safe Initiative.
Great.
Tiffany Wallace from Me Memorial.
Harry Robbins here.
Hi, Harry.
Leslie Brown, Mercy Air.
Okay, I think we got everyone. Welcome. So we will go to item 2. Any member of the public may address the committee for a period not to exceed 3 minutes on any issue not on the committee's agenda. The EMCC will listen to all communications but may not take any action. Do we have any public comment? Okay, hearing none, we will go to item 3, and that's the approval of past EMCC meeting minutes, and we will entertain a motion from one of the committee members.
This is Harry. I move approval with the understanding that from the minutes under public comment, we still have an open item with respect to narcotics overdose issue that was supposed to be addressed under good of the order, and I don't think we got to that. We may be covering that today. So
Okay.
It is on the agenda.
I thought we added it to the agenda. We did. Yes. Oh, yes, we did.
okay,
Okay,
so I
Great.
move approval of the minutes.
great. We have a motion and do we have a second?
I can second it, AMR.
Okay, thanks, Tino.
You bet.
Steve, do you want to do a roll call vote?
Yes, roll call. Carla Spencer, Chair.
Aye.
Michael Arquides,
Aye.
Harry Robbins.
Aye.
Motion, thank you. Jody Schaefer,
Aye.
Luz Garcia,
Aye.
Tina Nieto,
Aye.
John Anthony.
Aye.
Any members show up that we didn't call? Thank you. Motion has enough.
Okay. We'll go to the next item. Steve, are you giving an update on EMS week?
Thanks.
I volunteered on last meeting, so yes, he is.
Okay, great.
So as far as CMS week goes, just really want to thank everybody, this committee, our other committees, the field staff from first responders, EMTs, paramedics, RNs, hospital staff. We've got a great group of people who really are very, very passionate about EMS in Monterey County. And we do want to recognize that passion and the commitment to, the people of Monterey County to serve their emergency medical needs. So thank you, everybody.
Yes. If I may also just echo what Steve just said. And I want to say that I am privileged to serve this community. I am grateful for our partnerships and every opportunity that we get to collaborate. And I am very proud of the work that we are doing to move the system forward. So thank you.
And I will, I guess, ditto what both Steve and Teresa said and expound on the fact that we know, especially in the last year, it has been challenging. We have had to change the way we have done medicine, and just hats off to all of you for your hard work and dedication. We know it hasn't been easy, and hopefully looking forward to some better times to come. So thank you all. Okay.
Carla?
Yes.
One last thing, just if people are interested, I believe the board will be doing a proclamation of EMS week next week.
Yes.
And everybody's invited to, show up for the board meeting.
Oh, great. Is that
Watch on
Tuesday?
Zoom. Tuesday, the 18th.
Great. Okay.
So you can participate by Zoom and see the board recognize EMS as important.
Great. Thank you. Okay, in the next item for reports, we have meeting minutes for the MAC OBS committees that are in the packet. And then Teresa, item C, are you going to give us an update, EMS agency update?
Yes, thank you. The first update, and I think something that everybody's interested in, is that AMR and the EMS agency have agreed to a 2-year extension of the current ambulance service agreement. This action reflects the agency's commitment to ensure continuity of services in Monterey County, as well as AMR's express commitment to continue to serve our community. We are working with HR to fill the health program coordinator position. We are also working to execute a number of contracts that will increase our efficiency at the agency. And we'll hear a little bit more about that in some of our updates later. In our ongoing effort to improve our system, we have been taking a fresh look at everything that we do. And you will hear that from the reports that will be provided by staff, such as the PCR standardization project. yeah, so we continue to be very busy and be happy to answer any questions you may have.
Great. Do we have any questions for Teresa? Okay. We'll move to item D, Ms. Deborah Hopgood, to give our EMS Quality Improvement Program update.
Good morning, everyone. We held our CQI tag and CQuick meetings yesterday. And then we have our stroke and STEMI QI meetings coming up in the month of June. We will be sending out some information to reschedule those as we have a conflict with the state STEMI and stroke summits that they're holding. So that will be coming out shortly. I just wanted to hit some of the high level projects that we're working on at this point. As was mentioned, we're working on a project to standardize PCR documentation. So we're beginning this with our trauma patients and bringing together a group of stakeholders from the EMS agencies, transport agencies, BLS departments, and a representative from the trauma center at Natividad to provide input on a process to basically standardize the data points and how people are documenting different procedures, triage criteria, that sort of thing is related to our trauma patients. So the goal is to be able to pull data from within ESO a little more easily and a little more with a little more reliability as well. So that's one big project that we're working on. We've put together a draft timeline, asked people to start thinking about representatives for that committee, and we'll be putting out more information on that shortly. We also have 3 different LOSOPs in progress that we're working on. So additions to our optional scope of practice locally. Those are related to a unified scope of practice for our flight paramedics, monitoring of blood and blood products during interfacility transports, and then the addition of ketamine for pain management for patients as well. So those are all in progress. We're working on several efforts related to providing patient follow-up and outcome data to our EMS providers. SVMH has been kind of taking the forefront on developing some follow-up through ESO. They're working on a plan to provide that directly through the system. They've engaged with the EMS agency and various EMS departments throughout the county to do that. They may be reaching out to some people, some other agencies for additional information. So our goal is to hopefully use that as a kind of a model to take to the other hospitals as well and increase the information that's coming from those hospitals based on the model that SVMH has provided. We're also working on several contracts that will help provide outcome data. One with AHA for Get With The Guidelines access to STEMI and stroke data. Another one with CARES for cardiac arrest registry data. And then another one with Trauma One that will provide trauma patient outcome as well. Finally, we're working on an overall revamp of our data process, the points that we're looking at, the data that we're providing to our committees, and working with the epidemiologists to improve that data as well. Does anyone have any questions on any of the projects or items?
Okay, great. Thank you. And we'll go down to now item E for Mr. Jeff DeAndrea to give us an emergency response to COVID and the MOAC activities update.
Good mid-morning to everybody. The MOAC activity through the EMS agency has slowed in the last 2 months, directly correlated with the pandemic. There's been less demand on the agency and on the MOAC program for various resources. PPE is still being distributed to various providers and stakeholders as private supply chains are getting restored. We're definitely seeing fewer requests and less volume of PPE being distributed. We've shifted a little bit into syringes and needles and sharps containers as a backup support for vaccine clinics, even though the ancillary products with the vaccines usually suffice, but there's still a need for support there. Excuse me, sorry about that. And otherwise, the MOAC activities really not even half of what it was back in the surge during December and January. I'm still working just as much, doing other things. I want to acknowledge this team here, everybody out there, all of you on the call, fire departments, hospitals, clinics. Just want to state that Monterey County has done a great job. We had hiccups in the first few weeks, first month or so. We've all done a great job with the vaccination process. We're in line with the state as far as numbers and percentages of people vaccinated. And we've done a great job here in our little less than massive county. We've really pulled together, and there's a lot of cooperation and collaboration that's happened. And I personally have witnessed with several of you on this call, a lot of initiative and desire to reach out and connect with partners and other cooperators. So want to acknowledge all of us and all of you for that. And the MOAC program, even when the declared emergency hopefully is shut down in about 6 weeks, the MOAC program will still be available for whatever pops up. And we're ready also to serve, to support fire season, which we're on the verge of. So any questions? Great, thank you.
And thank you, Jeff, for all of the amazing work you did for us over the last year plus. Okay, so we'll go on to item F with Ms. Kimberly Hernandez for the Contract Compliance Working Group update.
Good morning. So I'm going to go through the contract compliance PowerPoint. And before I start, I'd like to advise the committee that some compliance percentages have changed since they were last reported due to an audit that was performed by First Watch, which is the online compliance utility that AMR uses. In March, it was discovered there was an error with compliance reporting through First Watch. This was because of a system update First Watch had in October. First Watch has since conducted an audit of all months after the update, and the changes in the compliance will be noted during the presentation. Okay, I'm going to go to the next slide. For the months of January and February, all priorities met or exceeded 90% compliance, pointing out that priority 1 in January was 89% before the audit and 90% after. Priority 1 in February was 88% before the audit and 90% after. Only one priority fell below 90% in the first quarter of 2021, which was priority 1 in March at 89%. In response time compliance green response area for January, priorities 1, 2, 3, and 4 exceeded 90% compliance, pointing out that priority 1 was at 91% before the audit and 92% after. Priority 4 and 5 were, priority 5 and 6 were not reported for January as they had not met the 100 call rule for the month. For February, priorities 2, 3, 4, 5, and 6 exceeded 90% compliance. Priority 1 was at 86%. For March, priorities 2, 3, and 4 exceeded 90% compliance. Priority 1 was at 89%. And priority 5 and 6 were not reported for March as they had not met the 100 call rule for the month. In response time compliance yellow response area, for January, priority 2 and 3 exceeded 90% compliance, pointing out that priority 3 was 91% before the audit and 92% after. Priority 1 was at 89%. Priorities 4, 5, and 6 were not reported for January as they had not met the 100 call rule for the month. For February, priorities 2 and 3 exceeded 90% compliance. Priorities 1, 4, 5, and 6 were not reported for February as they had not met the 100 call rule for the month. For March, priorities 2 and 3 exceeded 90% compliance. Priority 1 was at 84%. Priorities 4, 5, and 6 were not reported for March as they had not met the 100 call rule for the month. Response time compliance in orange response area. The only priorities that were able to be reported in the first quarter were priority 2 and 3 in February, both exceeding 90%. All other priorities were not reported as they had not met the 100 call rule. In EMS dispatch performance continues to be well below the 59-second standard through January, February, and March. MPDS performance, or Medical Priority Dispatch System performance. The new MPDS calculation went into effect in March. You will see two numbers for the months of January, February, and March. It is to show the change in the percentage. We went back and calculated January and February to highlight this change. For January, 69% of calls were EMD'd with the new calculation versus 55% with the old, a 14% increase. In February, 70% versus 54%, a 16% increase. And in March, 68% versus 54%, a 14% increase. And I have two slides on APOT, one on the 90th percentile and one on the average for hospitals within Monterey County. Please note when looking at the 90th percentile versus the average, the 90th percentile times will be significantly higher because 90% of APOT times will fall below the 90th percentile time shown, where the average is adding all of the time, then dividing that number by the number of transports. So in the 90th percentile, if you're taking from December to January, SVMH had a 32% decrease. From January to February, they had an 18% decrease, and from February to March, they have a 7% decrease. At CHOMP, they had a 7% increase from December to January, a 1% increase from January to February, and a 4% decrease from February to March. At NMC, they had a 10% increase from December to January, a 22% decrease from January to February, and a 16% decrease from February to March. At May Memorial, they had a 9% decrease from December to January, a 10% increase from January to February, and a 32% decrease from February to March. On the average for APOT, at SVMH, from December to January, they had a 22% decrease. From January to February, they had a 21% decrease, and from February to March, they had a 17% decrease. At CHOMP, from December to January, they had a 1% decrease, a 2% increase from January to February, and a 17% decrease from February to March. At NMC, they had a 3% decrease from December to January, a 24% decrease from so they had a 3% decrease from December to January, a 24% decrease from January to February, and then they had an 18% decrease from February to March. At May Memorial, they had a 5% decrease from December to January, a 13% decrease from January to February, and a 27% decrease from February to March. So APOT times continue to stabilize. Oh, the fee forgiveness program. So we're going to bring up a fee forgiveness program draft brochure. And while Estelle is bringing that up, I'm going to turn it over to Mike Esslinger.
Hi, everybody. Thank you. So basically, in collaboration with the EMS agency, we actually cleaned up some of the language from the original brochure to make it a little bit more concise and specific to the fee forgiveness program. For example, we actually changed the heading. The original title was Paramedic and Ambulance Transportation Service to Monterey County Ambulance Service Payment Options and Fee Forgiveness Program. So without walking through the entire brochure, basically the goal was to inform patients who may not have the ability to afford or pay any portion of their bill, the potential access of alternative payment options. So we also made some structure changes, formatting changes to the brochure. For example, we updated the address and fax numbers to general numbers that we have within our organization. And then for the first time, which unfortunately I was not able to have a draft for this meeting in time, but we're actually going to be designing this version in Spanish, as well as the informational document that includes the specific criteria that must be met to qualify for the program. So that's most significant with the brochure. Lastly, one of the things that I did want to touch on, though, is that we're also looking at customization options for the invoice and access to these materials online. AMR actually uses a, shall I say, a centralized and standardized billing process. So I'm not sure what type of ability we'll have to make those changes, but it's definitely something that we're looking to explore. And then also, I feel like last time I didn't probably do a very good job explaining. One of the public reps had brought up, whether or not we could provide these, this information in the ambulance, and we sort of deferred from, wanting to take that route. But one thing I think that's really key is it's not to say that we can't do a better job informing our patients that when they do express any, type of inability or concerns about being able to pay their bill, we do have some trigger options within our billing center that anytime somebody states that they would not be able to pay that bill, that it automatically shifts them to a patient advocate who is local here in California and able to help them navigate some of the different, programs. So whether it's the fee forgiveness program, the compassionate care, or any one of those. But this is close to final. We have made a few more very minor changes to the brochure. But I think that what you're looking at up there, for the most part, is basically the final brochure that we're going forward with. So, and thank you, everybody. I apologize that it's taken a little bit longer than expected to get everything processed and designed. But the final brochure is actually with our publications office. And we also have already started the process for the translation as well. So thank you. Not sure if there's any questions. And that's all I have. Anybody else?
You can pull it off as well. Thank you.
Okay, looks like that concludes Kimberly's report. Anybody have any questions for Kimberly or Mike? Okay. We will move on then to Roxanne for the other provider response time report.
Okay, so I'm just gonna share my screen. Hopefully you guys can see that. Sorry, I'm a little dyslexic today. Okay, so today I'm actually gonna present to you a report that we did last time with Carmel, and then also today would be also including Monterey Regional. So 2 reports, one for 90th percentile response times related to medically related calls in the county. So I'll begin again by looking at Monterey County Regional Fire, 90th percentile response times from January 2019 to April 2021. And then the last time we met, we did this similar or the same analysis using Carmel Fire Ambulance. So we'll also look at what's been continuing with theirs for the 2021. Okay. So the purpose of this high-level analysis, again, is to present a picture of the 90th percentile response times by Monterey County Regional around Monterey County. So to conduct this analysis, I extracted data from the Emergency Communications Department Computer-Aided Dispatch System, or the CAD, which is used across the system and documents several needed time-specific data elements for this analysis. So the CAD does not include response times in the CAL FIRE response areas. So for this report, I just excluded those calls. It is a low call volume for the 3 years of data so far. So we're just gonna stick to what's in the CAD. Once the data was collected in its raw format, I specifically looked at medically related calls that is directly linked to Monterey County Regional Fire Ambulance units. Information in the CAD report specifically identifies medically related codes and includes the dispatch date, the time arrived on scene, and the incident number. So the incident number is essentially a unique identifier. So if multiple ambulances were dispatched to the same call the system would capture how many units were dispatched, who arrived first, the order of arrival, and all of the other data elements that goes with that response. So the response time were calculated by using the difference between the time that the call was assigned to the time that the ambulance provider arrived on scene. So the data was also just vetted through, did some manual checks on Inform Browser just to look at potential errors and to reduce the outliers that you see in the data. And then the 90th percentile response time was determined by looking at it through all of the medically related calls identified in the CAD for the Monterey County Regional's response area. And then again, outside of this area, just limited to the data in the CAD. And so the summary of the data has 2,565 medically related responses into Monterey Regional's response areas identified in the CAD and then the surrounding areas. And then on their screen, you'll just see the breakdown. It's 1,617 total calls that we're looking at for within Monterey County Regional Fire's response area and 948 outside. So some important data limitations and considerations. Again, it's only the information that's in the CAD. It does not exclude Cashel or other CAL FIRE response areas. And it's also limited to medically related problem codes. The total call volumes as we go through this, it will range. So the smaller the call volumes that's reported, when you're reporting the 90th percentile, it may result in statistically unstable results. There is a known lag time between the calls from going through 911 communications to county comm and then back. So this is a contributing factor that may change the times that's in the CAD for like the initial dispatch time or the time that the ambulance gets assigned. COVID obviously is known to be a system-wide impact, and also the wildfires during the summer of 2020. So this is a potential consideration for the response times that we see in 2020. And then going back to the 90th percentile versus averages that Kimberly mentioned earlier, this report may be different from what you've seen on the public or what has been generated by Monterey Regional. And the picture here shows, so the 90th percentile is that data point. So it may be like the calls before it's less than that 90th percentile interval that is being showed in the reports that we'll look at, versus the averages that take the middle. And so half of the calls could be above or half of the calls could be below. So another consideration. So now that we're looking at Monterey Regional, I just want to make sure I didn't miss any important notes that I wanted to say before we continue. Okay, oh yeah, so another difference between the reports that you may have seen in the past, and this one, again, I'm stressing that it's only medically related problem codes, therefore it does exclude the times that is for other emergencies, such as rescue, structure fires, lift assist, or medical alarm calls that are in other reports. So these are just the 5, I'm gonna scroll back, these 5 problem codes right here. And the purpose of doing that is to just get a snapshot of the county's urgent and emergent responses. So now moving on to the overall. So there are 1,174 calls in 2019, 1,063 in 2020, and just from January through April, there are 328 calls. So totaling 2,565 calls noted on this chart. The average number of responses over this time period is about 91 calls per month. And even though there are some variations from year to year, for example, notable increase in February response times in 2020 compared to 2019, or a decrease in March 2019 compared to 2020. I did a linear regression statistical test and found that the response times were pretty consistent overall, and there was no statistically significant changes over time. So the 90th percentile intervals is consistently around 14 minutes, and therefore no significant changes over all the months that we ran. So how does this translate to just looking at the calls within to their fire response areas? Well, there are 1,617 calls from January 2019 to April 2021. This is about 63% of all of the total calls that are in this report, and about 58 calls per month. So again, even though there were notable variations from month to month, there were no statistical changes over the two-year, 4-month period. And the response times, again, were trending just around 14 minutes at the 90th percentile interval, even though you see some months go up to 30 minutes. I mentioned earlier that smaller call volumes does tend to cause some of these variations. So for example, February has 32 calls, and you'll see that 33 minutes. So it could just be a matter of a couple of calls just making that difference there. So, okay, so did I go through it that quickly? No. Response times outside of the fire response area. When you move out of the response area, again, you see degrees of variation. Overall response time is about 90th percentile interval, sorry, not response times, is about 18 minutes. The number of calls average about 34 a month since January 2019. And the first 4 months of 2020, the 90th percentile interval is just under 19.5 minutes with an average of 31 calls per month. The 90th percentile time is down from January through April of 2020, when the 90th percentile response time interval was about 23 minutes with an average of 31 calls per month. So an important consideration in this chart, again, is to note that the fluctuations are show no significant changes to medically related responses or to the overall 90th percentile. And then some of the fluctuations, again, is due to the lower call volumes that you see from month to month. Okay, so now I'm going to take a switch over to the Carmel fire ambulance, and the methodology is not different at all between the two reports. It's using the same problem codes, and we're just using Carmel's units and Carmel's jurisdiction or response area in the CAD. So again, CAL FIRE responses are excluded, and everything is limited to the information on the CAD. And again, the considerations are pretty much the same. For Carmel, the response area is greater than the 93921 zip code that are in many existing reports. And same things to keep in mind. Lower call volumes does impact the 90th percentile response time intervals that you'll see. And the COVID pandemic is part of the changes that you'll see in the call volume that may impact the time. So with Carmel Fire, I'm presenting the data just again from January through April of 2021. And I just put in a comparison to see where we were at in 2020 or where they were at in 2020. So I'm going to have to scroll down, see. I put a lot of notes here, sorry. So getting to the data, there are 348 medically related calls noted from January through April 2021. For this year, there's an average of 87 calls per month, and the 90th percentile interval at around 10.5 minutes. Comparing the same months at this time last year, 2020 had an average of 67 calls a month, and a 90th percentile was just under the 10-minute mark. So even with the increases in call volume and a 30-second increase in the 90th percentile interval, the response times had no statistically significant changes over time since 2019. And specifically looking at Carmel fire response area, which again is to keep in mind that greater than that 1 square mile of the 93921, and it is the MNT code that is used in the CAD. Carmel Fire had an average of 32 calls, medically related calls per month, with the 90th percentile interval about 7 minutes. So one of the things that I do want to highlight on this screen is that even though that there is no statistically significant changes over time, we do see some fluctuations, which has shown like a significant, I don't want to use the term significant, but a decrease from like March to April of 2021 versus in 2020, where we kind of saw the times going up. And that I think is really interesting in seeing how the demands of responding to the pandemic initially versus now a year later has really changed. And looking at the responses outside of their outside of the MNT, their designated area in the CAD. Again, all the calls, medically related calls, averaged to about 55 calls per month with a 90th percentile interval around 11 minutes. And comparing it to this time last year, there were an average of 42 calls with a 90th percentile interval around 10 minutes. So no significant changes, but you can see when responding outside, the times remain more consistent over the 2 years, like within the 2 years at this time. And that concludes my my presentation. I think that some of the big take homes from looking at both these reports is that their responses, 90% of responses have been pretty consistent, even when responding to the pandemic and to all the challenges that has been happening, and that we are noticing some decreases in the April data. So continuing to keep that in mind. Even the smaller call volumes also may have impacted some of the numbers, but we'll continue to monitor. And as the CAL FIRE responses accumulate, then that may be a future report that we can look at as well. And that is it. And does anyone have any questions or comments? So I'll stop sharing.
My only comment here is that I'm glad that we're able to see that information and hope that we can continue to see that on a regular basis.
Yeah, just it's Chief Urquidez. I just want to continue to clarify that all these calls that we just talked about, over 90% of them are actually in CAL FIRE's jurisdiction. So I think maybe Leanne, you could help Roxanne understanding that when we go to Cypress Fire District or Highlands or Kashawa, they're dispatched by CAL FIRE. So probably Roxanne, we just got to clean that up. That I think when you're thinking CAL FIRE, maybe the wildland component, but 90% of our mutual aid calls, we're going into CAL FIRE's jurisdiction where they're dispatched. So I just want to clarify that because my phone's blowing up with texts.
Oh, yeah, sure. So let me take a moment to clarify. So the information that's dispatched through CAL FIRE actually is in a separate report, which involves like asking CAL FIRE to provide us with medical response incidents. So that's completely separate and documented away from the CAD. So the responses that are from CAL FIRE are not in the CAD. So those would be two separate notes.
Leanne has raised her hand.
Yes, Leanne.
Yes, thank you. I was going to ask a few questions. Roxanne, if regional is going, their dispatch times and everything is tracked is in our CAD because we don't give them over to CAL FIRE. So, and then all medical calls still originated would still be triaged through AMR, which would still come through this CAD. So I think that's what Chief Urquidez was getting at. And then also, I when was reading the slides, had a question and I sent I sent a text off to my staff. I wanted to ask about the comment about the known lag time that you mentioned in both the regional slide and the Carmel slide, because I don't understand that. I'm not aware of any lag time.
So I discovered, or that I put that note in after after we presented the data to Carmel. So maybe I can defer that question over to them, because, there was the understanding, and, you can correct me if I'm wrong. There's a time period, and it could just be a matter of a couple of seconds where it goes from it's in 911 and then it gets transferred over to county comm and then has to get dispatched out. So the ambulance may already be en route, or because, they're listening, they're going, but the time that is documented may be slightly different from the actual response time out.
So Roxanne, I'd like to make some clarifications on those slides. 911 communications and county communications are the exact same thing. So EMS communications, it's transferred, but the actual creation of a medical and a fire call is done at the hands of the 911 dispatcher. As soon as an address is verified and we know that there's a fire or medical call, it is immediately sent for dispatch. Now, a change in type code to determine the code of response for an ambulance, there needs more triage, but a response from the fire department should go immediately once that address is verified. So, we are open back up here, Roxanne, if you want to come in for a tour or whatnot. We want to clarify this and make sure that we're supporting the stats that you're doing.
Okay, great. So I will make a note of that. And then if someone wants to chime in and ask, because I just document the way that I learn it. So I apologize if that was an error in the limitations and communications, but I just wanted to make sure that we were covering all of, not all of the bases, but most of like what it is. So I take the data out. So I think the big take home here is I take the data out of the CAD, right? Monterey Regional and Carmel Regional has their identified code for their district, and then everything else otherwise. So, so that's one report. So that's the report that I'm focusing on. Anything that comes into the CAD, or that is documented into the CAD that we can extract. And then it's just separated. So I'm going to use the term MCF, right? So that's for Monterey Regional. So that's what I would consider like in their district, or what I'm considering to be in their district. And then anything else that is not that, but has a response with their ambulance attached to it. So the ambulance arrived on scene, there's a valid response time is included as the other responses into the county. So if it is that, and the reason why I said CAL FIRE is not included, so I apologize if it is, and I'm not really like if that was my mistake, is because when I look at CAL FIRE, specifically medically related incidents, we do a request for data from CAL FIRE that gets sent to us, and it has all of the response time. So it has like, and I'll just use like the ambulance unit, the incident number, so the same data, but it is just an internal request. So those two reports are different. And that is maybe a misunderstanding of how, so in my mind, or the way that I'm doing the analysis, and it's my understanding of how the data is being put into the different systems, is that CAL FIRE has their report, and then the CAD has their report.
I think, Leanne, the agency would love to take you up on your offer. We want to make sure that the data, when it's brought to the committee, that is accurate, and that the explanations, do make sense.
Yeah.
Yeah, I think, I don't want to bore everybody else with all of this. I want to make one closing thing. CAL FIRE has their own dispatch center, and they have their own CAD. So they're going to have a different incident number and different tracking. But any ambulance, any resource that we dispatch for will be inside of our CAD. So all of those ambulance responses from both Carmel and Regional Fire will be in our CAD. I think it's just, we need to talk it through with, my subject matter experts and what you're looking for to get down to those regions, because both Don Clark and Leslie Rigonti can discuss with you maybe what to look at. And, we can maybe get someone from Regional Fire to have a few specific events as examples, and we can help one another get that data that will support what Regional Fire and Carmel are looking for.
Yes, I appreciate any clarification, any learning.
Just one other thing, Madam Chair, Spencer, real quick. And Roxanne, great work. It's just so imperative that, especially for Harry, who requested this is mutual aid 90 percentile, right? We're not comparing AMR's mutual aid 90 percentile, right? Where AMR is going to adjoining counties or into our area or Carmel. And that's, Harry, I think, is the missing component. We're looking apples and onions when I think people are getting confused with AMR's EOA 90 percentile and mutual aid 90 percentile. So if we're looking to make this a standing request for EMCC, there's a much bigger mutual aid component for all ambulance providers than just Carmel and regional. So,
Mike, I agree with that. That's exactly the comment I was trying to get to here, is that we don't want to mix mutual aid with a I'll call it a regular response. And we have to be very careful about that because of the differentiations you just enumerated. But I think we're going in the right direction here. We're getting a picture, which is our responsibility. It's not an enforcement aspect, but it's a picture of what the overall ambulance responses are within the county. And I appreciate that.
Okay, thank you all. Anybody else have any questions or comments? Okay, thank you so much, Roxanne. So we will then move to EMS system performance metrics and Kimberly Hernandez for communications testing.
Okay, hold on just 1 second. Pulling up the 800 megahertz. Okay. Okay, for 800 megahertz, for the month of March, AMR conducted testing on the 800 megahertz 94% of the days. Out of those days that the test was conducted, CHOMP responded 84%, ME responded 97%, NMC responded 90%, and SVMH responded 77%. For the month of April, AMR conducted testing 90% of the days. Out of those days that the test was conducted, CHOMP responded 52%, ME responded 84%, NMC responded 87%, and SPMH responded 84%. You can go ahead and switch it to ReadyNet. Just one moment while we switch the charts. Okay, for the ReadyNet MCI drills. So on this chart, you're going to see the 2020, and just note that there were no drills conducted from April 2020 to February 2021 due to COVID. For the month of March 2021, AMR conducted drills 94% of the days. Out of the days that the drills were conducted, CHOMP responded 74%, ME responded 71%, NMC responded 81%, and SVMH responded 87%. For the month of April, AMR conducted drills 93% of the days. Out of those days that the drills were conducted, CHOMP responded 53%, ME responded 87%, NMC responded 90%, and SVMH responded 87%. Anyone have any questions on the 800 megahertz or ReadyNet?
What happened to CHOMP in April?
Anyone from CHOMP?
I don't have data to reflect that, but I don't know if perhaps with the construction and the moving our units, we missed a test, but I know they have it set up and fixed now.
Any other questions?
Okay, thank you, Kimberly. And then we'll go to old business with Steve regarding EMCC membership.
Good morning again. We're going to look at the EMCC membership because our policy, talks about a specific term of office for the members, and we need to have nominations for the members from their constituent group. We've received quite a few of the nominations, and they are in progress. Some updates, I believe, from your report that's part of the packet. You'll see that John Anthony, we have listed that we're waiting for the nomination letter. We've received the nomination, and it has been submitted to for approval to the board. Let's make sure I don't have the same page. All right. For alternates, we have Bandy Smith has been nominated for County Parks representative. And as far as our citizen reps, we're reaching out to the hospitality industry to potentially help with some people to nominate for citizen rep alternates. In addition to having to be nominated, some members are ending their term of office. Chief Michael Arkides has been a longtime member and is stepping away from the position on EMCC. And so we'd like to definitely extend a very, very heartfelt thank you for his participation at EMCC. And in my time here, he's been a constant presence. And it's been very helpful and considered. And we do thank you for your participation, Chief. It's been a pleasure having you with us. And then along with that, of course, we need to have someone fill the position. And Deputy Chief Sam Klemick from Salinas has been nominated to fulfill that position. And I think that's it for the changes. If we don't have your nomination, law enforcement, please make sure your constituent group submits the nomination so we can get the appointment completed before the July 1 start date. Am I missing anything? Any questions related to the EMCC membership?
Just one comment, Chief Requites. We've worked together for a long time, and Mike, I really appreciate your efforts and your professionalism. You will definitely be missed.
Thank you. And you'll be in good hands with Chief Klemick. He's worked in the system on the private side and the fire side. So you'll be in good hands. Thank you.
Okay. Thank you, Steve. And definitely thank you, Chief Arkides. It's always a pleasure to work with you. And I'm sure we'll continue to see each other. Okay, next up on our agenda, we will move to new business, and we will have Kimberly talk about OD maps and ESO interface.
We met with Dr. Close, and Dr. Close gave us some updates that she's now receiving overdose data from AMR, Monterey County Regional Fire, and Salinas Fire. She's able to take that data that they're giving her and log it into OD maps. Monterey PD and Soledad PD have been inputting their overdose data directly into OD maps. Dr. Close has spoken with Pacific Grove PD, Carmel PD, and Fire, Greenfield PD, Gonzales PD, and King City PD, who have all expressed interest in this project and currently are working on further details on how to work with her. Dr. Close now has access to CHOMP's ESO and can take CHOMP's overdose data from ESO and log it into OD maps. She also advised that Dr. Locke at SVMH has access to SVMH's ESO, and SVMH is working on the logistics on how to log their overdose data into OD maps as well. OD maps is also possibly going to reach out to ESO on how to integrate OD maps into the ESO software itself. Dr. Close has supplied AMR, Carmel Fire, Monterey County Regional Fire with leave behind naloxone kits, which include tip cards, wallet cards, user guides, and Good Samaritan law information. And AMR has been providing information to Dr. Close on how many kits they have left behind. Anyone have any questions?
Kimberly, when would we expect to see the maps, if that is the plan?
I'm sorry,
When would we expect to see the maps?
the OD maps?
Yes.
Well, that, I'd have to talk to Dr. Close further on that, but I can get back to you on that.
Okay, fair enough.
Oh, is she still on there?
I think she's on the line.
Yeah, absolutely. I'm available. We can, whatever is most convenient, I can make sure that you have access to kind of screenshots of what we're seeing prior to these meetings. So you have that to share with the group, if that would be most helpful. And then we can also work on figuring out how to get this committee, someone on it, direct access into the system so you can pull it up in real time. Whatever's most convenient, we can get that taken care of.
It would be nice, I think, if we could see the maps at the next EMCC meeting, but I'll defer to your judgment on that one.
I agree. It would be great.
Perfect. Let's get that worked out. Kimberly, we can work on that offline and have it prepared by next meeting. Thank you.
Thank you.
Any other questions for Kimberly? Great work. Okay, we'll go to item B, election of officers for Steve.
We'll make it easy. It's that time of the year. It's time to elect new officers for the next fiscal year for EMCC. And so the EMS agency would recommend that this body nominate new officers, the chair and vice chair at this meeting, so that they are in place for the July 1 start of the next year for this committee.
Madam Chair, I have a motion, if you'll entertain a motion.
Yes.
I move that we elect, I put a name in nomination, Tino Arellano, and Chair and Chief Tina Nieto as Vice Chair.
Great. Thank you. There's been a motion. Do we have a second?
So move.
Was that you, Mike?
Yes, sorry.
Okay, sorry. And do we want to do a roll call vote, Steve?
So just as a point of reference, we appreciate the nomination. Just want to make sure that, there's adequate discussion before it moves forward, just in case someone else might have an alternate nomination. Nothing against Tino and Tina, but just making sure the process works.
Okay, so maybe let's back up and ask for any discussion amongst the committee.
I always wait to hear what Harry has in mind for nominations, and I completely support them. They were actually the names that I had in mind as well.
Agree. Okay.
Sounds like discussion.
Sounds like no further discussion. Okay, and then we could do the roll call vote.
Okay, roll call vote. Carla Spencer.
Aye.
Tino.
I'll abstain.
That's fine. Give me a moment here, because. All right, Chief Rickades, you did the second, so I'm.
Aye.
No change. Okay. Jim Leinborg.
Aye.
Harry Robbins.
Aye.
Jody Schaefer.
Yes, aye.
Luz Garcia.
Aye.
Tina Nieto.
Aye on Tino, and I'm going to abstain on myself. And thank you, Harry, for the extra work.
All right, and John Anthony.
Aye.
Great, thank you very much. All right, and We did not see Paul Wood, Dr. Greenson, or Greta
Paul Wood is here.
Steinbrunner.
Paul Wood is here.
Paul Wood is here.
Paul Wood is here. Okay, thank you.
Aye.
Perfect, thank you. All right. Looks like it carries.
Great. Okay, and then we'll go to item C. Teresa and Dr. Burley for an EMS agency annual report.
Thank you. Your packets included our 2019-2020 annual report. As with everything else, we have also taken a fresh look at the annual report. Similar to our QI committees, we kind of try to do a reset in the way that we approach the annual report. First, we changed the reporting period from a fiscal year to a calendar year. In the past, we would prepare the annual report at the end of the year in November, December. And so now we changed it. We thought it would be appropriate to present our annual report at the May meeting for this committee, since it's also EMS week. We also want the report to speak to a broader audience. We wanted a different way to tell the story of the work that we do. And if you have already read the report, you can see that despite the many challenges that we faced in 2020, that we did accomplish a lot. Working on the annual report, it always gives us the perfect opportunity to look back and just put some of the things into perspective. We move every day, working on being responsive to the needs of the system, that the annual report allows us to step back and then take a look at the work that we have done. So I want to thank all of our stakeholders and committee members for your valuable contribution to our system. And I want to thank the team, for all of the work that you do. I am very grateful for your dedication and everything that we have accomplished.
Thank you, Teresa. And I'll just also echo what Teresa has said. It's been an interesting year, 2020. It's not necessarily what we anticipated moving into the year, but as happens with EMS and fire, you don't necessarily control what you're presented with. And our job at the agency and your job at the hospital and in the field is to manage what you have. And so that's been the kind of year it's been. A lot of challenges, not just the COVID-19 pandemic, but the wildfire season made things interesting. We had some flash flooding. We had the opioid epidemic, and all of these things. We didn't do this alone, and we had to rely on the partnership that we have with all of the stakeholders. And we just really want to express our appreciation for that relationship. This is really the only way a complicated system like this works, is if we do it together. And so thank you all for the role that you played in helping us make it through this past year. And we look forward to continuing that collaborative process in the future.
Great, thank you both so much, and thank you for the nice report. Anybody have any comments, questions for Dr. Burley or Teresa?
Carla, it's Mike Urquidez. Again, I'd just like to thank the EMS agency, Teresa and Dr. Burley. Putting on an annual report is so much work for staff, and we just appreciate, I think they did a great job capturing everything that they're able to help EMS responders last year with all the policy changes and the COVID testing from vaccine. And again, I think they did a great job capturing that in their annual report. So I just want to thank them and their staff.
Carla, I'd like to add that the level of detail and complexity of that report is most impressive. And I think it clearly points out to me what the agency has done and what the staff has done and the quality of the work that's been evident therein. So my appreciation from a system standpoint.
Thank you. Anyone else? Okay, great. So we'll need to move to the next item, announcements. For the good of the order, any member of the committee may make announcements or comments. The EMCC may not discuss or take any action on any item raised during announcements except to decide whether to place the matter on a subsequent agenda. Do we have any announcements?
I have one comment. It's my appreciation of you, Carla, for chairing the committee for this last year. It's been a challenging time. And again, the complexity and amount of detail that we've had to deal with is most amazing. So I appreciate your forbearance and professionalism. Thank you very much.
Thank you, Harry, so much. And it's been my honor and privilege to serve on the committee, and look forward to a better year and, getting past some really tumultuous times.
There seems to be somebody raising.
Somebody.
Yes, this is Leanne. I wanted to, in front of the EMCC, thank the EMS division department for acknowledging National Dispatchers Week last month. They took the effort to bring some very special treats to our dispatchers that were greatly appreciated. And I wanted to acknowledge all their hard work to acknowledge others that are a part of this. And thank you very much.
Great.
Hi, this is Tina Nieto. I just want to thank the board for their work and everybody else that makes this board very successful. But I also want to acknowledge the police officers. Yesterday was our county police officers memorial procession. Usually it's held. We have a service, but because of COVID, it was just a procession all the way. We did it from South County all the way up to Marina. And I just want to reach out to all those who supported it, including the fire department that came out to support our public safety. So thank you.
Thank you.
Carla, just one quick comment as my last meeting. Again, thank you for everything you've done as chair, and to the rest of the EMCC committee members. The one thing, again, I would ask for, and I think Roxanne has the talent to be able to do this. At someday, when I heard on the performance report for AMR, if someday we could really figure out the priority one details, like for example, AMR was at an 89% performance standard and 90's the threshold, is again, nowhere are we making it transparent with the 18 fire stations that have advanced life support that is getting there before AMR, and some way if we could ever have that study conducted. So I think the EMCC can see, we had an example call last week in our district. We got there in 6 minutes and 14 seconds. It was a significant stroke call. Actually, one of the board of supervisors was present, and they saw the full process. AMR got there in 10 minutes in a 12-minute response zone. But you can see that we somehow, we'd love to show the EMCC the value of ALS fire. I think we always concentrate on AMR's performance, but I think it's time for the EMCC to see how that system works. And I think Dr. Burley could understand that, being a prior paramedic. We just need to make that transparent someday. And it seems like Roxanne could make quick work of a study someday showing that. And those are my parting comments. Thank you.
Mike, I appreciate your comments in that respect. The contract compliance working group is looking primarily right now at late calls, and the breakdown that I've asked for is whether in fact, how does that interface with the ALS response as well? So we're approaching that, and I think we all have the same goals and objectives in this regard. We're getting there slowly but surely, looking more and more at the context of the actual response, both between fire and ambulance in a coordinated effort. I think that's what I'm hearing from you as well.
Is that something, Harry, you think we might see in a future report in the near future? Do you think it's going to take some time for us to see a little bit more detail?
Carla, we've looked at that very closely. We're still scratching the ground. It seems like every time we look at one aspect of another detail pops up. And so I would say that is a work in effort right now. I would anticipate that we'll probably see something within next 3 to 6 months, but I would defer to the staff to get a more definitive estimate as to when we'll have something quantitative to bring forward to EMCC.
Okay.
But we're working in that direction.
Did someone say something in the room?
I was, this is Teresa. I was saying that it is on our list of priorities. We have been, prioritizing the different items that we have to look at. So, but it's part of the work that we want to bring to the committee.
Great. Okay.
My thought on this is basically that the responses are coordinated between first responders, AOS, and some instances BOS, and the ambulance. We need to look at the quantitative aspect of the total response, and not just the isolated ambulance response. If we're looking at the whole picture is what I'm driving for. And I think we're moving in that direction.
Yeah. Okay, great.
Sorry, I have one go back. I would also urge anybody, all the newest EMS staff, Dr. Burley, Teresa, we would invite them to do a ride along on our ambulances. I think it's so important for them to see now, since the vaccines are in place. And again, we would encourage anybody to come do a ride along in our system. And I think it would help them understand some of the rural areas that we serve, mutual aid and or our first in area. So thank you.
Ride-alongs are part of what we've done in the past, of course, with COVID and just, some staffing issues as we experience them. Those have not been done on a regular basis, but it is part of our goals for each year for each staff member to do some ride-alongs. So once we are able to, we will resume those.
Great. Okay. Any other announcements? Okay, our next meeting is probably in July. I think, Steve, we have just a little typo on the agenda.
Yes, we do. It's Wednesday, July 14th.
July 14th. Okay. Same time, same place. And we will then adjourn the meeting. Thank you so much. Happy EMS week and happy hospital week as well. We're celebrating this week. And everyone take care and be well.
Thank you all.
Sure.
Thank you, everybody.